Hi there. Welcome to the While You Wait podcast, where it's all about helping women just like you learn about the bladder while you're waiting for your appointment with that specialist. Each week, I'll combine science, medicine, and common sense so you can learn, become empowered, and get started on your journey to dryness. I'm your host, Dr. Sarah Boyles, a board-certified urogynecologist. Let's get started. Hi there. I'm here today with Mandy Pulliam, who's the CMO of Axena Health, which produces the Leva Pelvic Health System. And I brought Mandy back because I wanted to talk more about the Leva Health System, mostly because I think it's amazing, but also because they just released a paper looking at how well their device works after 2 years. So, Mandy, welcome. How are you today?
Fine, thanks. I'm happy to be here.
You're not convincing me.
I'm not?
I may need a lot of reassurance today. So, in the first trial, when you guys first started studying the Leva, can you remind everybody what the Leva is and how women had to use it?
Sure. So the Leva Pelvic Health System is composed of two things. One is a vaginal wand, that gets placed in the vagina. It's embedded with accelerometers. Those are the same things that show you the position of your phone, right? If you move it one way or another, it goes from portrait to landscape, so you're looking at the picture right side up. So those aligned all together sort of take on the shape of the vagina when you place the wand in the vagina. And then as you do pelvic floor muscle training, the lift and the motion of the pelvic floor upwards and forwards is reflected when it connects to your phone. So in the phone is an app. It contains a ton of educational materials, all designed by pelvic floor physical therapists. And it also contains an exercise program where you perform pelvic floor muscle lifts and squeezes for about 2.5 to twice a day. So the 2.5 minutes consists of lifting for 15 seconds and then relaxing for 15 seconds. And you do that sequence 5 times. So that's what the Leva system is. Also, a little bit separate from the Leva system, but something we offer as a company is we offer personalized coaching so that every woman who receives Leva is assigned a coach who helps them through understanding how to use Leva and then helps coach them so that they meet their goals. A lot of that is around making sure you remember to use Leva, but we watch you through the 12-week program, which is how long women engage using Leva.
And Leva is unique because you have to have a prescription, right? You can't get it over the counter. And
That's
then
right.
The other thing about it is it tells you that if you're doing your exercises correctly, if you're actually squeezing versus pushing down, which is something that so many women do incorrectly just because they're very, very difficult muscles to engage.
You can't see them.
Right. You can't see them. There's no joint that's moving. I mean, I always feel badly when I say that because I feel like it comes out in an accusatory fashion, right? People just aren't doing this correctly, but it's something that you really need to work on and be taught to do, which I think makes this device so much more effective than anything else because the other strengtheners on the market can't tell you if you're squeezing or pushing down, right? It just tells you if the pressure is going up.
Right. And when you measure pressure, it doesn't tell you if it's the right kind of pressure. It just tells you if there is pressure. So if you bear down, that causes pressure. If you squeeze and lift, that also causes pressure.
Yeah, I think most people just don't have that, can't tell what they're doing. I mean, we see that all the time in the office when we examine people. Right. It's just a hard part of the body to engage correctly. So they do it twice a day, 5 days a week for 12 weeks, correct?
That's right.
And then how much better, what can I expect if I do that?
How much better? By a year out, actually by 2 years out now, because we just published this data, but over time, 2 things are true. One is that using Leva is superior to doing home pelvic floor muscle exercises on your own. So we've talked about how you can't see those muscles, and I think it makes intuitive sense to say that it helps. But also what we found is that women who use Leva are between 2 and 2.5 times more likely to report feeling improved or better from doing the exercises. So using Leva is better than the alternative.
So I'm thinking in my head, how do I translate that, right? When people in clinic ask me.
Yeah.
So if someone says, okay, I'm going to use this for 3 months, what can I expect? Am I going to feel like this is the last treatment that I need? Am I going to come back and am I going to say, oh, well, I'm much better, but I feel like I need an additional line of treatment? What can I expect?
Right. So what we found, and let me just say before I say this, that how you feel about your urinary incontinence treatment is really about who you are and what your expectations are. So most of the time, women have goals about what they expect from their urinary incontinence treatment, right? Some women want to go run a marathon. Some women just want to be able to go to the mall without having to rush to the bathroom and leak on the way. And I think the level of what we can expect from a cure or a treatment is really about what your experience is and what you need out of your experience. And so in some ways, it's really hard to say 100% of women are treated or this. It's more important to say how many people had improved symptoms and what those seem like. So, for example, we know that after 8 weeks of treatment, women had an 80% overall improvement in leakage episodes. What that means is that some women had 0 leakage episodes in the course of 3 days when they collected information, and some women had 1 or 2. So think, is everyone satisfied with that? It depends on what your life is like, but largely 80% is a huge drop in the number of leakage episodes that you have.
Yeah. And I mean, I think you're right. I think that's important to remember that it really does depend on your goals, right? It is one thing to be trying to be dry during CrossFit, right? And doing kind of a maximal lift. And it's another thing to be dry, when you're kind of walking your dog. And not that they're not both achievable and important goals, but it does kind of differentiate.
Yeah,
So,
absolutely. And one other thing just to add, in our app for women who are prescribed Leva and in the interactions with coaches, we actually have a time at the beginning where women set goals for what they anticipate they want out of their urinary incontinence treatment. And as much as we in science can measure all of the things that are sort of scientifically able to tell us about urinary incontinence, the key piece is whether you're happy with your outcomes. So in the app, take some time to look through those things and talk with women. The coaches talk, and also enter into the app what your goals are when you get started.
yeah, it's interesting too, because I feel like, or I know that over time goals shift. So your initial goal is I want to be dry during, this activity, and then you're
Right.
dry during that activity. And then, you want more and more and more, right? And I
Yes,
think
you
a
do.
lot of times with incontinence, when you're 95% dry, that remaining 5% becomes incredibly frustrating for
Right.
women,
Right.
right?
It's
I mean,
true.
the goals do shift a little bit.
Yeah. I think that just underscores how much we put up with in terms of leakage, right? I mean, a little bit is okay, a little more is okay, and suddenly you're coping with a lot. And then as you find improvement, I think you begin to want even more. And from my point of view, I think that's right. We
Uh,
ought to want even more.
I agree. I mean, I completely agree with everything you just said. We were talking before we started recording, and I recently spoke to Chantal Dumoulin, and one of the things that she said, it's so interesting when you talk to someone and all of a sudden there's a little bit of a frame shift and it changes the way you think. And she said to me that she doesn't believe that there's any such thing as a small amount of leaking, and small amounts of leaks are much easier to treat. So why wouldn't you start when it's small? And I think that is
Absolutely.
completely the opposite of what most women are told, right? I mean, most of the time you're told, oh, that's just a little bit of leaking. You should put up with it rather than addressing it and making it better so it doesn't become a big problem.
Absolutely, absolutely, and I think there's enough embarrassment attached to leaking for whatever reason that women don't want to do anything about it as long as they can hide it. And the truth is, I think that's the perfect moment to begin to do something about it.
Yeah. Yeah. I mean, I totally agree. Right. And then you have, especially if you're doing it with exercises, then you have these tools that you can engage at any particular point in time. So if I use the Leva and it worked for me after 12 weeks, I mean, let's say at 12 weeks, at 6 months, I said, yep, I'm in that 80%. I'm super happy. This is working for me. What can I expect at 2 years?
All right. So we did a big research study, and we asked women to use Leva. Actually, in the study, it was for 8 weeks instead of 12. And then we watched how they did and asked them how they did at 1 year and then again at 2 years. And what we
Can,
found was that, oh,
can I interrupt
sorry.
you for a second?
Of course, please.
So you,
Am
I
I
mean,
speaking English?
you told, you are speaking English, but you told them to do the exercises for 8 weeks. And then
Right.
after that 8 weeks, they did not have to do anything, right?
They
They
did
were
not have
kind
to
of
do
on their
anything.
own. There was no encouragement. There was no recommendation to keep using the
That's
device,
right.
correct?
That's right. We did, and they could continue if they wanted to, but only about 8 of them did. Everyone else quit. And, I mean, they weren't asked to do so. So it wasn't, wrong to choose to continue, and it wasn't wrong to choose to stop. What we found, though, was that regardless of whether you continued or stopped, because we're able to understand how they did, whether they used the lever or not, we were able to look at the information that they provided us and analyze it with and without those people who use lever, continued to use it. And we found that the results were maintained. In other words, the success that you achieved within that first part of the program was maintained at 2 years.
So why is that? Because I have to tell you that when I work out, that doesn't work for me, right? If I
Right?
do it for 8 weeks and then I stop, I'm pretty much back to zero.
Don't we all
So,
wish that worked in the gym?
right. So why does it continue? That doesn't make
Yeah.
any sense.
Yeah. So we've done a little bit of thinking about that and talked really with some physical therapists and others who kind of oversee rehabilitation. And what we know about pelvic floor muscles is they're a little bit more like your spine than they are like your bicep, right? So we're both sitting in chairs right now and we're using our spine. So can you strengthen your spine? You can. But the other thing is that to a degree, your spine continues to be strong because every day you use it just by being up and around. So those are called structural muscles. And the pelvic floor, those are structural muscles too. So we think what happens is that when you go through an 8 or 12-week program, you learn what to do and how to do it properly. And then when you're finished, you continue to do it properly because you use those muscles in your everyday life. You squeeze your pelvic floor every time you get up out of a chair, every time you sneeze, every time you go for a walk. And so rehabilitating it is in part strengthening it, but the other and maybe more important part is learning how to use those muscles correctly. And that part stays with you. And those exercises are then integrated into the rest of your life.
Are you going to keep following these women over time? Is 2 years the end, or are you going to continue asking the question?
Right. So 2 years is the end for us for this study. But one thing that's true is that we have lots of women who've used Leva as part of a prescription, being a prescription product. And we're gathering information about them based on what they tell us about their experience. And we can follow those women out for a long time. It's pretty expensive to do the kind of research
Yeah.
that goes on and on and on. And after a while, too, not so many women participate. So the data is not as meaningful.
So, based on what you just said to me, it makes me think that we should be much smarter than we currently are, right? Because we currently treat people when they have problems. So, do you think that, there's a point where we should say, okay, look, you should engage in pelvic floor physical therapy or, strengthening with the leva at, this particular point in your life, this particular, let's say before childbirth or after childbirth, at menopause, and then again, if you have any problems after that? I mean, should we be being more proactive about this?
I do think so. So there's a couple of different times in a woman's life when I think it might be important to do pelvic floor muscle training. The first is probably prevention. We don't have data about prevention yet, but I think it makes intuitive sense to say that if you keep your pelvic floor muscles in shape,
Yeah.
then regardless of what happens to you, kind of come what may in your life, whether that's having a couple of children or going through menopause or whatever, you're in better shape to start off with. I mean, we see this now, for women who are undergoing things like orthopedic surgery, we try to get them into shape beforehand so that their recovery afterwards will be better. And I think too, if you think about giving birth, I mean, that's a trauma and a big sort of affront to your pelvic floor, I guess, or really hard on it. So good to be in shape before. And then I do think there are a couple of times in women's life where rehabilitation is really important to sort of get on top of, even if things seem to be working well. So if you have a baby, that's definitely, it's a lovely thing. And it's also a trauma to the pelvis. I mean, for obvious reasons, right? I mean, babies aren't small. So rehabilitation after that, learning again how to use your pelvic floor muscles properly would be a great start after that towards prevention and towards maintenance of continence. Sometimes women leak a little bit after a delivery, or they leak a lot and then it gets better within a year or so after giving birth. But I think maintaining good functioning muscles after that, that's one time. And then the other time we see a lot of women come to us is right at menopause. And I think what we know about whether menopause causes incontinence is a little bit unclear, but I do think that there are changes in a woman's body that happen at menopause, and they may just bring to light old traumas, right, from childbirth or something. But I think that's another point in time where working right then to begin to rehabilitate, even if you only have a small amount of leakage, is a really important thing. I mean, after that age, you just lose muscle mass anyway, so it's good to stay in shape on all
Yeah.
levels.
No, it's true. I mean, lifting becomes so important. And I think the other thing about that menopausal period is it's also a period where women know they're going through changes. They're more likely to seek care because of those changes. And it is also a time where they, because of, children starting to leave the house and that type of thing, they may have more time than they
Yeah,
previously have, right? So there are kind of some external factors that may make it a little bit easier as well, besides the, direct changes that people
right,
see.
sure. They have a little more time for themselves,
Yeah,
possibly.
right. Which, women only take care of themselves when everyone else is okay.
That's the truth. The truth.
So, your device, I mean, I think I can say this without, exaggeration or hyperbole. I mean, your device is the most well-studied device on the market right now, right? So, there are a lot of pelvic floor trainers that are out there, a lot of devices that are out there to help with incontinence, but most of them are very poorly studied, if at all studied. There was a study that came out in 2019 and looked at all of the devices on the market and kind of the research behind it. And, at the end of that study, their conclusion was that sample sizes were small. So most studies looked at, somewhere between 10 to 50 women. There was a lack of convincing evidence for most devices. But despite this, many devices are available on the market. And, their findings indicated that the process for introducing new devices is very different from introducing medications, right? So
Right.
meaning that things can be on the market with very little data. So why are you guys studying this? Like, why don't you just put it on the market and use the money for marketing instead of research?
Well, in short, I think it's because we as a company and I personally believe that women deserve to use products that have been shown to work. I'll say without hesitation that in the course of my career, and I practiced clinically for 25 years, there have been dozens of those things that come across your desk. Here's one, here's one, here's one, and they all seem like a great idea because I mean, women want to do things at home. They want to do things, in privacy and on their own schedule. And in many cases, they need to, whether it's because they have a child or a job or whatever. I mean, and I think it's tempting to just try one, honestly. But I think that women deserve better than that. And so as a company, we decided to make the investment because we believed it was important to know, does this help? And the other thing I'll just say is that the other reason for us to do this research is because we were a new type of product. I mean, all of the things out there, they're not all the same, right? The information that we provide women about how their pelvic floor muscles are working or moving when they exercise is based on these motion-based sensors called accelerometers. And the motion is a different kind of information that you receive in contrast to pressure, or there's another more esoteric thing out there called muscle depolarization. So there are those types of feedback. So we wanted to do the research because this is sort of a unique new thing. I mean, you could look at an ultrasound and that'll show you muscle motion, but those are expensive machines that usually sit in doctors' offices, not in your home.
Yeah, well, and it's hard. I mean, I would tell you, even for me, when I look at, the different websites of different products and try to figure out what works and what doesn't work, there's very little actual data. There are a lot of testimonials, right?
Mm-hmm.
People who liked the product for whatever reason. But that doesn't necessarily tell you, how it works in 3 months, how it works in, 2 years, how it works compared to doing exercises on your own, right? And
Right.
and so I think having that information and that data really is just so very, very valuable and, kind of raises the standard. I mean, it's kind of ridiculous to say, but it's nice to know how something works before you buy it.
The other thing is, I mean, we believe, for better or worse, that urinary incontinence is a medical problem and it deserves a serious solution, not something that you sort of giggle with. I mean, women laugh and joke about urinary incontinence, in part of because it's embarrassing, in part because there are things to laugh about. But I think in general, if you have a medical condition, you want a serious solution, not just something to kind of mess around with. So
Yeah.
I think it's helpful to do that. And also, I mean, it's also important, I'll say, that you feel happy with the experience that you have when you use a product. I don't think that's, I mean, it's great if it works, but if you hate using it, you might not. So I think we work very hard to pay attention to what women have a need, as far as their coaching experience that we provide, and also their educational needs and other things as they go through the process. We actually have a survey going on right now. Our team is looking at what women's impressions are of both the experience with Leva that led up to their deciding to go ahead with Leva, and what they think they need out of those educational opportunities. And so that survey right now is open to women who use Leva, and it's just helping us learn. We want
Mhm.
to continue to make a product that women like to use, as well as one that's effective.
I think it's also really helpful for women to know that they can use this product for a finite amount of time and then they should be better and they don't have to use it in an ongoing fashion. I think one of the things that's really daunting for a lot of people about pelvic floor physical therapy is the idea of, needing to do something formal
Right.
in an ongoing fashion, right? Rather than incorporating it into your day-to-day life.
Right. I think that's right, and I think I mean it's a lot to ask someone to participate in something for 12 weeks that A, you don't know if you can do, like can you make all the appointments, and B, you're not sure if it's going to work. So I think data really helps that. Gives you comfort that it's really, if 80% of women have improvement and you can experience an 80% reduction in urinary incontinence episodes, that's worth a try.
Yeah.
That's a pretty high, pretty positive rate of success.
It also seems more standardized to me than going to see a pelvic floor physical therapist. I
Mhm.
think you get a very different experience depending on the pelvic floor PT that you see, and some people are really good. Some
Right.
people don't have as much experience, so having, kind of a very standardized experience, I think,
Right.
just makes it more effective.
Right. And I mean, I think pelvic floor physical therapists are fantastic. And I think that for some women, and maybe women with, complex pelvic floor challenges and disorders that are not only urinary incontinence, for example, pelvic floor physical therapists are a perfect solution. But I think for a whole lot of women, they have urinary incontinence. It needs to be treated, and they have a schedule and a level of commitment to other things in their life that make it really hard to complete the course of therapy. And I think that's where something like Leva steps in to really meet the needs of those women, really at home where they are, or in the office where they are, or wherever they are.
Well, and especially since you're making sure that they're doing the exercises correctly,
Right.
right?
Right.
So
That's what.
what's next?
What's next? Well, we've just done a review and submitted a little more research for of about 950 women who have completed use of Leva, and we'll publish on that as soon as the journal has peer reviewed our article, and looking forward to that. One of the important things for us is insurance coverage. We believe that again, as a medical condition, women deserve therapies that have been proven to work that are covered by insurance, and so we're fighting that good fight every day to make sure that as many women as possible can have access to Leva. And then we'll look forward to some other opportunities down the road. We're indicated for fecal incontinence. And so we're working to provide more education in the app for that and support women who have fecal incontinence who use Leva. And we've got some other indications and some new things coming down the road that we're looking forward to. I think most of which will either serve to expand the reasons that women might choose to use Leva or support them and the physicians who prescribe as they seek to help women navigate really the care pathway. How do you decide, someone who should use pelvic floor muscle training? What if you have really severe urinary incontinence? Should those people have pelvic floor muscle training or not? So we're working on some data that will help kind of clarify those questions moving forward.
Yeah. That's, all of those things that kind of help clinically pointing people in the right direction and getting them to
Yeah.
an answer more quickly, I think is so very
Yeah.
helpful rather than, just kind of doing it based on your own intuition. Well, I just want to thank you. I think you guys are setting a new standard, right? And hopefully other companies will start following this. And I, totally agree with you. I think that women deserve more data. They deserve products that work and have been shown to work and aren't just going to waste their time and money. And, incontinence for me is such an important condition because I feel like it is, kind of a gateway condition where if it's not treated, it can just lead to so many other comorbidities. So mental
Absolutely.
health issues and physical issues and social issues and, personal and intimacy issues. So I think it's just so important to treat it to help us all age gracefully.
I think that's it. And women, honestly, we live a long time. And I think the important thing with living a long time is to live well a long time. And so if treating urinary incontinence can make your life better as you grow older, and even when you're young, maybe more importantly even then, but both of those things are important and worth attending to now.
Yeah, and I totally agree with that. And I would, yeah, I mean, we said this earlier, but I would say treat it before it's a big problem, right?
Right.
Treating it when it's a small problem is just easier for you and, means that you don't have to experience all the negative consequences that come with more moderate and severe leaking.
Absolutely.
So, all right. Well, thank you so much. I really appreciate your time.
Thank you.
You're welcome. Thanks for listening. If you want more information about me or my online work, check out my website at www.thewomensbladderdoctor.com.